Keratoconus is a condition in which the cornea, which is the front surface of the eye, starts bulging outwards abnormally. If I show you here on this eyeball, this is the structure of the normal eye, and this is the cornea. When the cornea starts bulging outwards, it does not allow the light to be properly focused on the retina, and as a result of which the vision markedly reduces and is not corrected with eyeglasses or even in the late stages with contact lenses. So the cornea is a very important medium to transmit light in the eye, and if there is any defect in the curvature of the cornea, then it will result in abnormal vision and inability to see clearly. So keratoconus directly affects the curvature of the cornea, as a result of which it starts bulging outwards. What causes keratoconus? Keratoconus is a genetic disease in many cases, and sometimes it is also seen in patients or in children who rub their eyes a lot. As a result of excessive rubbing of the eyes, the cornea, it tends to bulge outwards, and it results in this condition called keratoconus. The age at which keratoconus starts is very early. Sometimes children, because of allergies to the eye, they rub their eyes at a very early stage in their life. So we see that many times, even at the age of 5 years or 6 years, the eye starts bulging outwards and the cornea gets affected very badly. What is the treatment of keratoconus? In the initial stages, it is best treated conservatively by giving them contact lenses. There are different types of contact lenses, but normally gas permeable lenses are preferred. Nowadays there are special keratoconus lenses called as rose-K lenses, and they are available and they fit the cornea very well, giving good quality of vision. To prevent the progress of the disease of keratoconus, it is always imperative and important to treat it as soon as it is detected, so as to prevent its progress and make it stable. The way we can do it is the treatment called C3R. It stands for collagen cross-linkage, and in which we use riboflavin, which is vitamin B2 drops, and ultraviolet light, which is a special light, and with the reaction of the light with the riboflavin, the bonding of the corneal tissue takes place, and it makes the cornea very strong and very rigid, so as to prevent the bulging of the cornea. This is the most important breakthrough in the last one decade in the treatment of keratoconus. The second treatment is intacs or intracorneal ring segments, which are implanted in the corneal tissue, and this helps to stretch the cornea and flatten the central part of the cornea, helping to maintain the curvature of the cornea and give good quality of vision. If the keratoconus has reached the last stages, then the treatment is cornea transplant. And in cornea transplant, there is a latest treatment, what we call as DALK, or deep anterior lamellar keratoplasty, in which we do not remove the full cornea but only one portion, that is the front portion of the cornea, is transplanted. So in short, keratoconus can be treated very well nowadays with the latest modern type of treatment which we at OJUS are imparting to everybody. This is the normal cornea with a normal curvature of the cornea. In keratoconus, the cornea starts bulging outwards. This affects the vision of the patient because the light does not get properly focused on the retina, and the images what is seen is very blurred. With age, the progress of the keratoconus causes more blurring of the vision. Intacts are semicircular PMMA rings which are implanted in the stroma of the cornea. These rings are semicircular and normally 2 of them are implanted. Once they are implanted in the cornea, the curvature will become flat, as a result of which the vision will become normal and clear. They are not visualized as they are transparent. If the keratoconus becomes very advanced, then cornea transplant surgery is done. And in cornea transplant surgery, we remove the tissue of the cornea and replace it with another cornea. This is the cornea transplant done.